Good afternoon, Henry Longfield. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It's always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel is your greatest skill as a nurse.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. Please start your OET speaking roleplay.
Hello there. My name is Henry Longfield, and I'm one of the nurses here. I can see you look quite worried, and I notice you're holding a tissue to your nose. That's perfectly understandable. Coming to the emergency department can be stressful for anyone. I'm here to help you and figure out exactly what's going on. To start with, could you please tell me in your own words what's brought you in to see us today?
Hi. It's a bit embarrassing. I have something stuck up my nose. It started to bleed and I can't get it out.
Thank you for telling me, Mihiraa. There's absolutely no need to be embarrassed. We see this kind of thing quite often. It's important we get the details right so we can help you best. First, could you describe the ingestion in detail to me?
Sure, it's a small round plastic bead from a craft project. I was trying to see if it would fit in my right nostril. I know, it was really silly, and I accidentally sniffed too hard and it went all the way up. That was about an hour ago. I've been trying to get it out since then.
I see. Thank you for explaining that. It's very helpful. Now, Mihiraa, besides the bleeding, what other sensations are you experiencing? Such as any pain, difficulty breathing, or dizziness?
It's really uncomfortable and sore inside my nose. I feel like I can't breathe properly through my right nostril at all. It's making me feel a bit panicky, which is why I might seem a bit breathless. And yes, I do feel a little bit lightheaded.
Thank you for describing that. Let's talk about the bleeding itself. Can you tell me what the bleeding has been like? For example, is it just a slow drip or more of a steady flow? How many tissues would you say you've needed to use to manage it?
It's not pouring out, but it's more than just a drip. It's been a steady trickle. I think I've gone through about 3 or 4 tissues since I got here, and they've been pretty soaked.
Okay, that's good to know. Before you came in, what first aid did you take, Mihiraa? Did you try to remove it with your fingers or by blowing your nose? Also, have you taken any medication?
Yes, I tried to blow my nose really hard a few times, but that just seemed to make it worse, and the bleeding started. I also tried to poke at it with my finger, but I couldn't reach it. I haven't taken any medicine for it.
Thank you for being so honest. That leads me to some very important safety instructions. Mihiraa, the most important thing you can do for us right now is to stay as calm as possible. It's completely normal to feel worried, but try to take a moment and just breathe. Right now, since the object is in your nose and it's bleeding, we need you to follow a few simple, but very important instructions to keep you safe until the doctor can examine you. First and foremost, please try to breathe entirely through your mouth. This will ensure you're getting enough air and will prevent you from accidentally moving the object in your nose. Crucially, do not try to remove the object yourself, and please avoid sniffing or blowing your nose forcefully in an attempt to get it out. I know your first instinct is probably to clear your nose, but attempting to remove it or blowing hard can actually make things much worse. If you push on it or blow your nose, you risk pushing the object further up the nasal passage, which could make it much harder and more complicated for the doctor to retrieve. It could also increase the bleeding you're already experiencing. In a worst-case scenario, forceful blowing could even dislodge the object backward, creating a risk of aspiration, meaning the object could be inhaled into your windpipe or lungs, which is a serious medical concern. So, for now, please relax, keep breathing steadily through your mouth, and allow us to take care of you.
Okay, I'll try. Breathing through my mouth. No more blowing. And what is next?
Perfect. Now, regarding the next steps, here is what will happen. Mihiraa, I will first take some basic observations like your blood pressure and heart rate. After that, a doctor will need to examine your nose closely. Depending on what they see, they may order an X-ray to get a better view of the bead's position, or they might need to refer you to an ear, nose, and throat ENT specialist. The doctor will then decide on the safest way to remove it. With that in mind, what questions or concerns do you have at this point?
How long is all of this going to take? I'm really worried about it.
That's a very common question. Mihiraa, I know you're in pain and want to be seen right away, and I completely understand that. While I can't give you an exact minute-by-minute waiting time, I can explain how things work and reassure you about your care. The emergency department operates based on a system of triage, meaning we constantly assess and prioritize patients based on the severity of their condition, not just the order in which they arrive. Since we have to be prepared for sudden critical emergencies, the wait time is always dependent on the priority cases that come through the door and the availability of our doctors and specialized staff, like an ear, nose, and throat ENT specialist, who may be needed to help remove the object. Because of this, any specific time I give you could be inaccurate, and I don't want to mislead you. However, please be assured that your situation is being taken seriously and has an elevated priority in our system. Mihiraa, the fact that you have a foreign object in your nose, coupled with active bleeding, means you need a prompt assessment. We certainly won't ask you to wait for a trivial amount of time. The doctor will want to assess the location of the object and control the bleeding quickly to ensure your safety. We are actively working to get you into an examination room as soon as possible, and we will keep you informed along the way. Your care is important to us, and we will get this resolved efficiently.
Okay, that makes me feel a bit better. Thank you.
You're welcome. To get started, do I have your consent for me to go ahead and take your vital signs now, and for the doctor to proceed with the examination when they are available?
Yes, that's fine. Please go ahead.
Excellent. I'll just get the equipment. Remember, just keep breathing calmly through your mouth. Mihiraa, you're in good hands.